primary, immunization against tetanus.
So, and yeah, adolescents, actually immunizations for Hep B, I think infants get that one.
Oh, yeah, we should.
Yeah, we do. Older people can get it too if they've never had it, but they now do give that to babies, infants, it's part of their. All right, what else you got?
For what, primary or?
Give me another primary. Okay. All right, what about secondary?
I did a physical.
A physical? And that can apply to any age group. But what promotion topic would you use for a physical? Promotion topic, health promotion topic on the opposite page. So the topics are important to be able to relate them to age groups. That is the whole point of this activity, is to point you to that page with the health promotion topics.
Oh, okay.
Here. Health promotion topics. So what did you say? What did you say was the physical examinations? So, but look at the dental checkups for children. But that is appropriate, that is a important topic for children because their teeth, cavities, teeth falling out, stuff like that. And then older adults, it says dental oral health, drug management, health screening recommendations, foot health. So you see there are specific topics related to the age groups. All right, tertiaries. Let's do one of each as we're going around. So what with cancer patients? So not just cancer patients, what is a support group? That's good. Support group for cancer patients, yes. Drug management for rehab. So drug management, $249 and $250. Yes. Yeah, but is it primary, secondary, tertiary? Drug management. Drugs. If you're managing the drugs, it could be, it's not really rehab. It's gonna be secondary. Medications are secondary. All right. So we did all three? They got you? I spend a little time with this because it can be confusing, and sometimes I even have to stop and think. So if I have to stop and think, that means you really need to study, right? Okay, so give me a primary example that you came up that hasn't been mentioned yet. That's gonna be hard by the time I get over there.
I use, using seatbelts, so.
Very good, so teaching someone about using seatbelts is a primary level of prevention. And what age groups could you do that with?
You can do that with infants, children, adolescents.
All right, so what would be a topic that I would use for seatbelts in the health promotion topic?
Safety promotion and prevention.
Yes, is that specifically for infants?
For children, infants, and I believe, I know it's somewhere else. Yeah.
So safety promotion and accident prevention is adolescents. It changes with children, it's safety promotion is injury control. And it's the same for infant safety promotion is injury control. So infants and children are the same, but adolescents are different. And then when it comes to safety for older adults, it says safety precaution. Yeah. They're at risk for all kinds of stuff. Yeah. All right, secondary. Y'all listen up.
Risk assessment for specific
So a risk assessment for a specific disease is primary. A risk assessment for breast cancer, a risk assessment. Look at your book. Risk assessments are primary. Risk assessments for a specific disease, primary. You have it under primary. Yes, I was asking secondary. Okay, so it's important to look at 249 and 250. If you get confused, and then you can also Google levels of prevention nursing. Make sure you put nursing, or you might get some kind of occupation that we're not looking into. But levels of prevention nursing, and you can get good examples that way too. But risk assessment specific disease, you can see it's listed right here in the primary. Okay? What's an example of secondary over here? An age group.
I did mammograms.
Mammograms. Mammograms is for, y'all know what age it is?
The
35.
I think it's 40. Yeah, 40.
They have to wait for the breast tissue to start softening before they can squish them.
And I think it's also if you have a history of breast cancer in the family too.
Yeah.
Yeah. But it wouldn't fall under older adults.
Older adults, yeah. All right, what's an example, in an age group topic for tertiary? Y'all? Speak up.
So with sorry. So if you had a client that was pregnant, had gestational diabetes, establishing a treatment plan where they would test their blood glucose level and incorporate a diet to.
So, if you had someone that was pregnant, had gestational diabetes, and you are checking their glucoses and you're trying to manage that,
Is that more secondary?
it's more secondary. It's more secondary because it's the managing, it's the going back to the doctor over and over again to screen. You're screening the blood sugar. So you're screening. Now, say you have, and I can just kind of go off road here. Say you have that patient that had gestational diabetes, and they've been going to the doctor and having their blood sugar screened, and it's not doing well. And by the time they deliver, they end up with all these complications. And during delivery, she codes, and they save her, and now she has brain injuries from being resuscitated, and she has to go and live in a rehabilitation center. That the physical therapy, that kind of stuff, now that would be tertiary. I actually took care of a resident that it was so sad because everybody was old, and she was 21, she had a stroke during delivery. And we took care of her for a year and a half. Her parents would bring her baby to see her. And when she started learning how to walk, I gave her some tennis shoes. They were bright yellow, she loved my tennis shoes. Okay, I gave them up. But yeah, that'd be tertiary. So, all right, back here, primary, with age group and a topic. Immunizations. Infants, children, and older adults, that is correct. Secondary. Colonoscopy is the secondary. Age group, older adults. Tertiary. That's a slippery slope because you are managing medications. Managing medications is gonna fall into secondary. Your patient with diabetes with hemoglobin A1C of 12, which is extremely elevated, ends up with an amputation and has to go to rehabilitation to learn how to walk with their prosthetic. That's tertiary. So tertiary yes, diabetes is a disease process, but a lot of people in secondary are getting screenings to manage their disease process. Does that make sense? Yeah, so what happens is the blood sugar is so thick, blood sugar is high, it causes the blood to be thick. So the circulation doesn't go to the lower extremities, and that's why they lose their limbs. So they end up with yes, medication is gonna be secondary. I would make medication, I would make it sound like it's something else, like, what about birth control? Birth control itself is primary. They go to the health department for family planning services, that's primary. They get a bag full of birth control that they need to start taking. Taking the birth control now becomes secondary. Because taking the medication, managing the medication is secondary. Going to learn about it is primary.
Yeah, because that's the tertiary,
But you're also trying to have rehabilitation, you're trying to improve something. That is a slippery slope. I see where y'all come from.
managing and making sure it doesn't get any worse.
Yeah.
Like taking it in.
I'm gonna Google it.
I'm gonna Google it for like the trends.
Since your book doesn't say specifically about medication management, administering medication is secondary. Oh, I like these definitions. Primary, intervening before health events occur. Secondary, screening to identify diseases in the early stage. Tertiary, managing disease post-diagnosis to slow or stop. So that would be, you're right. Tertiary. Managing the medications to control the disease is tertiary. Administering the medications is secondary. Like if you're in the hospital, you're administering medications, that's considered, according to your book, it's considered secondary.
Treating symptoms would be tertiary.
Huh?
Treating symptoms is the same thing.
Treating symptoms. All right. So your book specifically says for secondary that it's the nursing assessments and care provided in the home, hospital, and other agencies to prevent complications like maintaining skin integrity, turning, positioning, exercising clients, assuring adequate rest, food and fluid intake, promoting fecal and urinary elimination, administering medical therapy such as medications. So that's why I say administering medications is secondary, because it's right there in the book. Referring, when it comes to tertiary, support groups, teaching a client who has diabetes to identify and prevent, I see that's where you're getting that from, prevent complications. That is tertiary. So trying to prevent those complications with diabetes would be tertiary. All right, we did all three on this table. This other table in back, primary.
Sex education, adolescents.
I like that one, sex education for adolescents. What is the primary concern with adolescents? Y'all think about it. What is the primary concern with adolescents with everything that we do with them? It is huge today too, because it's all over social media. Peer pressure. We have to worry about what their friends do too, because they may do something their friends did that was stupid. But sex education is primary. What's the secondary example?
A new client to visit their physician every 6 months to check their blood pressure, to get their teacher do the history and application of that.
Very good, very good. Tertiary example.
Referring a client to a support group or option.
Yes, alcohol rehab, support group, very good. All right, back here, primary. Teaching them about STD, you said yes, that is a level of, primary. Secondary. It's a type of screening. Genetic testing, we usually do that in our younger people. Not older adults, and there's actually not a category for adults. People who make mistakes, they get genetic testing. All right, tertiary. I like that. Getting special equipment for people like have cerebral palsy. Tertiary. All right, primary. You're all by yourself.
My primary, I have, family planning, information, and that usually runs from teens to,
As long as they're furrowed.
and also, vaccines, infant children, and older adults. Secondary, mammogram for older adults, bone density, older adults. Tertiary, mental health programs, APs, and, sometimes older adults use, physical rehab for all ages, tertiary, all ages.
Okay. Are we down on that?
Yes.
I'm doing y'all now.
She already said no, it's too late.
Primary.
I mean, ours are kind of repeated from what everyone.
They're kind of repeated?
Yeah, they
Secondary, are they repeated? Okay, and new?
We did, for secondary,
Okay. You got anything different for tertiary?
I said they're very fine with it, sorry, SCI injury to rehab center, to receive training that will maximize use of remaining ability.
Okay. Y'all got anything else to add? Primary?
Stress management for all.
Stress management, I like that. Stress management. Okay. Breastfeeding a newborn baby. All right, secondary?
Anybody see STD testing?
STD testing, that would be secondary. No, they haven't. Very good. All right, you got a tertiary over here that nobody else has said? Huh? AA group? Yeah.
Spinal, like helping patients, spinal surgery.
Yeah. Recover, yes, like a rehabilitation type thing. So if I was to say that you have, that you are addressing your clients and, how much time I've got? I got 1 minute. You were addressing your patients and you needed to pick a topic for your older adults clients. And you have, these 4 to choose from. Sleep patterns, exercise and rest, safety promotion, and adequate sleep. Which one is it for older adults? Adequate sleep. You see how they're similar, but yet they're specific. Okay, let's take 10.